Good afternoon, fellow citizens. My name is Masesa Demiano, and I welcome you to the Citizens Chat Show. On this day, we want to, of course, discuss and also put our thoughts on the presidential address that just happened a few days ago. On the panel, and of course, the people that I'll be engaging with are a few of the selected team of panelists that will give us the real in-depth context of the conversation today, and we'll need to understand where is the problem or whether we shall do quite well in ensuring that we give value to this conversation. So just right into the conversation that, the address that the president gave. Of course, there are 5 key issues that he talked about. He talked about COVID-19 vaccination. He talked about the surveillance around COVID-19. He talked about safe reopening of sectors under lockdown. Of course, the patient care. And finally, the strengthening and decentralization response of the districts. So joined on the panel today, maybe right from my right is Andrew Karamaji. Andrew Karamaji is an activist and works with the Action Aid also. Andrew, you're welcome.
Thank you for having me.
And I think this is your second time on the show.
Pleasure.
Thank you very much. Right from Andrew is Sarah Bireete. Sarah Bireete is the Executive Director of the Center for Constitutional Governance, but also a regular panelist. Sarah, you're welcome.
Thank you, Damien, and good afternoon, viewers.
Thank you very much. Then the maiden appearance today is Mr. Willis Bashasha. He's also the Director of Manifesto Implementation in the NRM.
Yeah, actually, Office of the President.
Office of the President.
Viewers, good afternoon. It's my pleasure to be here, and this is my maiden appearance, and I hope I'll enjoy the show.
Thank you very much. And then finally is Amoding Monicah, lawyer, gender activist, but also a former woman MP for Kumi. Yeah, Monicah, you're welcome.
Good afternoon, viewers. Yeah, and it's always a pleasure being in this space.
Your second time on the show.
Yes.
Thank you very much for coming. Right into the discussion, of course, quite a lot of issues came clear from the address of the president, and we need to just keep picking a leaf from the issues that kept coming out in these 5 areas, and possibly we need to start with the COVID vaccination itself. And right in the conversation, while the president was making an address, he made a directive to the COWs, to the RDCs and DHOs, and he told them that they need to ensure that these vaccines are finished in these centers. And failure to do that, of course, they will lose their jobs. So I need to understand, is there full compliance? Will there be full compliance? And as a country, how do we go about this? Of course, we are seeing these sectors, these people will have to lose their jobs if the Ugandans don't comply. Andrew, I need to start with you on that.
It's a public policy question, in my opinion, and specifically for public policy in the areas of public health. First off, from the address, it's not apparent, and if you do further reading of, say, budgets, I was reading last night, preparing for this discussion, it's not apparent from budgets or from policy whether our health system is curative or preventative. That said, if you think about the infrastructure, quote unquote, that we have today, from the village, the health centers, through to the national referral level, from district, regional, up to the national referral level. And if you also consider questions of workforce in terms of health workers and so on, it's not apparent that that directive or those instructions will fall on fertile ground, if I may use that analogy. Because it's unfortunate that a head of state should speak and those words fail to find where to land. Which health workers are we talking about? What's the infrastructure for immunization? I had an opportunity to read up on something that was called UNEP, Uganda National Expanded Program on Immunization, that was there some decades ago. It was clear how vaccination was conducted for the killer diseases, particularly polio. In this current context, even if you think about the Uganda Virus Research Institute and other supporting entities, I don't see how these district health officers can mobilize through whatever miserable infrastructure there is to ensure that we have the kinds of numbers. At least the initial we had is 4.8 million people vaccinated before these vials expire. So the question I'm posing is one of public policy, but it also extends to the practicality of these directives. I'll end by saying, for now, you do not fatten your cow on market day. You have to have fed your cow, before market day. You don't wake up on market day and say, now we're going to fatten the cow. Then you'll have nothing to take to the market.
Thank you very much, Karamaji. Maybe I need to get to Mr. Willis. Just right there, Karamaji talks about the public policy issue, and it's a policy issue that we are now discussing, and it clearly brings out that, of course, with the analogy that you can't fatten your cow on the market day. Do you think that there is capacity, or is there capacity down to the grassroots, especially with the cows and RDCs, to ensure that there is full compliance, or the mobilization will be effective to ensure that we have the people in these districts vaccinated?
Okay. Thank you very much, Damian. First of all, as a Christian and as a believer, allow me first to thank God that we are still alive, some of us, because this is something that came in as an ambush. Probably we didn't know how long, or its deep consequences, and as you see, it is something that has almost touched every fabric of our society. So I want to thank God that we are still here, and also condole with those who lost their dear ones along the way. Now, coming back to the issue you are raising, I actually want to differ a bit with my colleague. One is that the issue of vaccination is not beginning with this instruction that we got, that the President's directive of last night. It is an exercise that had started some time back, but I think which had been challenged by the availability of the vaccines themselves. The issue of capacity to handle it, it could have been there, but I don't think it is as a big challenge as the availability of the vaccines themselves. And if you have looked at the recent statistics that were availed from the status of vaccination in this country, you already have districts which have recorded 100% and plus. So how was that achieved? So to me, it's a question. I think what the President was trying to put across was like to rally a cause, and rally a cause among those who are responsible to how can we ensure that this exercise is given more effort than probably we have deployed to be able to achieve our target. And as you are aware, this is also an issue that involves death. So beyond even the President giving instructions, I believe like any duty-bearing office along the chain of ensuring that we can be able to vaccinate our citizens and achieve 100%. You don't even need to wait for an instruction. It should actually be on you patriotically to say, I am a health worker, I am an RDC who is responsible for telling people the dangers and the demerits of being without vaccinated. I am an LC5 chairperson in my area of work. So it's not about sacking or no sackings, no. It's all about raising the moral consciousness of your responsibility as an office bearer, that how can you add more effort in this struggle to ensure that Ugandans are vaccinated. And I'm happy, and I want to salute the efforts of government in trying to mobilize the vaccines. So now I think the challenge is on us, the citizens, to take advantage of the availability of the vaccines and to increase our uptake. And between me and you, colleagues, you are very much aware that many of the challenges we have had with the vaccination program is the negative attitude, which is even manifesting highly in some of us who are elites. And in the second wave, many of our friends who are elite were highly hit simply because they didn't see any sense in having this vaccination. We are not yet sure of whether the vaccination can give us the the 100% efficacy that we expect. But however, it is believed that in case this problem attacks again, if you are already vaccinated, the resistance is higher than if you are not vaccinated at all. So to me, I want to say that all is there, all is set, and I think it was also incumbent upon the head of state to add spice in that direction so that all of us can be up and deliver in that mandate.
Okay, thank you very much, Willis. And I think maybe we'll need to pick on from that going forward. I need to bring in Sarah. Willis just talked about, I picked out 3 issues. First, he talked about the availability of the vaccine currently, that we have the vaccines now. But also, he also talked about the negative attitude that we as citizens have towards taking up this initiative. But what we are trying to understand here is that even that has been available in some districts, we are seeing a calls on expiry. We have over 20,000 doses that were recorded that are getting expired by the end of this month. Do you think that these that are around will be taken up? The initiative will be taken up?
Well, before I answer your specific question, I think to me, right from the first wave, I think God knew how long it takes for Africans to get organized around a crisis of the nature of COVID. And he gave us time. He gave us time. We all watched how Europe, especially Italy and US and then China, suffered. So we spent from end of December, January, the whole of January, February, watching what COVID was doing in developed countries. We registered our first case mid-March. So we had 2 months to watch and understand COVID, as Africa generally. I remember in 2019, I was in The Hague. I came back with a nature of flu I had never seen, and it was towards Christmas. It lasted through Christmas. I had never got such kind of flu. So part of me keeps telling me that maybe it was COVID, because I had never seen such kind of viral infection. But later my doctor prescribed the medicine and I was able to recover. But after like 3 weeks of really terrible virus infection. In January, we saw the outbreak, China, Europe, Italy, people sleeping on the roads.
India.
And why I'm bringing that background is how prepared were we in the first wave? Of course, we didn't know some things, running on the job, but we had watched, all of us, be it citizens, be it policymakers, be it the presidents, the highest level of decision making. And then the first wave came. Out of that scare, indeed Parliament passed whatever money executive wanted. But the mistake we made from inception is the exclusion of other arms of government in management of pandemic. COVID has become like an executive affair with executive orders in this country. Parliament has no role except approval of budgets for COVID. They are trying now to get back on their oversight, but it is post-mortem. Because oversight begins as you scrutinize even the expenditures as they are planned. So, and on that basis, I want to point out to the effect of directives. Now the president, because I heard now they are trying to regularize directives with even creating penalties, he has become a lawmaker. That is the function of Parliament. But because of executive handling the pandemic on their own, it has turned the executive into a legislative arm when it comes to COVID regulations. Regulations are supposed to be passed by Parliament in this country, not the executive. So that is the first lacuna I want to point out. The second lacuna, building from that, we do not have a comprehensive national response plan for COVID. After 2 years of the pandemic, we are still in a knee-jerk mood. Before the president talks, nobody knows what is going to happen, which sectors are locked down, which sectors are eased. This should be a consultative effort of executive and parliament. But we have the executive doing all this work on their own. And this is why we have some of these challenges that we have been battling with. But away from that, the rollout of vaccines. I have, in my home area, people are looking for vaccines. Even when we say vaccines are about to expire, some areas cannot see the vaccines that are about to expire. So my first question is, what is the comprehensive plan on vaccination, including vaccine acquisition, distribution, utilization, and even watching the utilization and expiry period. And then also vaccination comes with massive sensitization of people. I know that we are all trying to sensitize people when in the spaces we have. There is a lot of vaccine hesitancy, which I really don't understand. Many people who are hesitant on taking these jobs were immunized against the 7 killer diseases. They have been immunized against yellow fever. Scientists have said that these are the same protocols used to develop vaccines. What changes is the variant definitions of a disease they are trying to prevent. So you have somebody who has had like 10 immunization jabs, now saying I cannot take COVID jab. And they will give you all sorts of reasons. And then you are like, but how about the ones you took before? And did they kill you? So I think we should collectively find a way of demystifying that propaganda of vaccine hesitancy, but the shabbiness in the management of COVID has not stopped, and it will not stop with the vaccines unless we get a comprehensive COVID response plan as a country.
Thank you very much, Sarah. Monicah, like Sarah said, of course, she hints on issues around the shabbiness. We are not highly organized to ensure that we can have as many people get these vaccines also. But like possible, let me try to pick from your experience as a former member of parliament. You had a constituency to take leadership on. How easy or how complicated is it to have mobilize the people for an initiative like this one?
Well, first of all, I want to thank Sarah and my colleague panelists for giving us a general overview of the state. Of course, I want to agree particularly with Sarah that the response to this matter, such a level of a crisis, a challenge, that is a global pandemic, but the way we are responding to it individually as countries, of course, depends on the leadership that is also available and offering the national response. In the case of Uganda, I want to first say that given the weaknesses of the general response, I think Ugandans have been quite nice and fair in terms of following the instructions or directives that have been coming largely from the presidency. And as it has been noted, it has been centralized in the sense that most of the stakeholders have not been participating in the actual interventions. If I give an example of Parliament, when the pandemic started, everybody was running back and forth, to see what can be done. And basically, the role of Parliament was to give the resources needed for the response, and also to put in place legislation, which has not been concluded up to date, because yesterday's presidential address again indicated we have not actually concluded. The Public Health Act has never been amended, and also the regulations that were coming have kept coming in piecemeal. There are still more to be done, and Parliament has not concluded on that. And going back to the challenge of vaccination or the uptake of vaccines in this country, I certainly want to agree that it is about, largely, it's not just about acquisition and distribution and rolling out the vaccine to the people, but largely the sensitization in line with its uptake. And central to this particular vaccine is the fact that there are so many issues largely coming from the religious angle of it. And I guess that is what the government has not been able to really explore and understand and utilize the various stakeholders in that line. And yesterday I heard the president talking about requiring support from religious bodies now that he has opened the churches and people are going back to church physically, and was calling upon the religious institutions to support in mobilization. There is a gap in terms of sensitization. There is a gap in terms of engaging other stakeholders. Key in this process are those religious leaders, because what is challenging this particular vaccine is not like the other vaccines that Ugandans have been taking up. This one has got something that is argued to be a connotation of religious background. If you ask most of the people in different churches, a majority will tell you they have not yet been vaccinated. Why? Because we are reading different things concerning the vaccine. And so we need to adopt another approach in terms of ensuring that the religious and faith institutions are engaged in mobilization. I want to give an example of my district, Kumi. It's one of those hot spots where the virus is, every other day we receive cases, and it is one of those areas where we need to pay attention and understand why is that challenge going on. And for Kumi, I think the practices, people continued organizing, going for barriers, doing all sorts of things. Even when members of parliament, emphasize as, leaders in the community, tell people to stay away, enforce, the SOPs, but people just don't follow them. The gatherings continue to go up in the same numbers. Even this 200 here will be overtaken. It will go to thousands. You remember we're in election time that whole year, but still the barriers in Teso can never go down. People attend barriers. It's like a ritual that must be honored. So, and then the uptake of the vaccines has its own connotations in the public. I will give an example. A very prominent person took this vaccine the first time, and then he went for a booster. As soon as he took the booster, he got sick. So and now if you go to Kumi and ask people to take this vaccine, they are up in arms. No one is willing to go willingly to go and get this vaccine without being coerced because of a job. Now, that is what was declared. He was pronounced dead from COVID, And it's a very recent death, and not like a month ago. It's very recent. So I think that the sensitization has to go beyond urging people to go and get the vaccine, but also dealing with the issues, the benefits, the ingredients of the vaccines, what are they made of, the types that are available, and also the preparation of the mind of the person that this vaccine is actually important and good. Rather than using the approach of directives and saying, teachers, if you do not get this vaccine, you shall not go to work, or the nurses, the frontline workers are actually taking it because they have no choice. And unfortunately, I'm one of those who is still waiting for that kind of information from these vaccines. The elites who has not taken up the vaccine for many reasons. And I don't decampaign it. Yeah, of course, very religious to say. And but that aside, I think that Ugandans have been very, very responsive in terms of following the SOPs, and if only we can do more sensitization and urging people to follow these SOPs. COVID is here to stay. We are going to live with it for much longer, like any other disease that has come. And so I think what government should be emphasizing is the fact that we need to find ways to enforce SOPs and to live with this disease. Because then, if we don't, the sectors that are affected continue. We are losing so many things in the economic fiber of the society. The education sector is likely to collapse. because of the enforcement of, you know, what I call the presidential directives in terms of prevention and all that. So, yeah.
Thank you very much, Monicah. Andrew, maybe back to you. Speaking from what Monicah has just said, you realize there are issues that are now beyond, that are spiritual, and you know, and now you had earlier began this conversation on the policy, that what is affecting and why possibly we cannot go as far is because we lack the real policy issues that would plan to ensure that a comprehensive plan to help us or guide us further. I want to bring you on to try to give us shed a little light on which could be the best of these approaches that could help fit into the scares of people who are religious, but also the other elites who are still hesitant. Yeah.
Public health, in my opinion, is both an art and it's a science. It's not a military operation. Unfortunately, what we have here in many ways resembles a military operation. My colleague Sarah was gentle and said the executive has taken over and has excluded all other institutions. I think if you zoom in further, it's actually the military. The operation is being conducted from that perspective. And some people might say this is a mundane point to say even the language of war, of defeating, of this is an art, but mostly it's a science. And the point I want to bring out, also Sarah and Honourable Monicah brought it up, around including other institutions and not letting this be an exclusive affair, and then trying to correct your wrongs. One thing I'd like to point out is that to make a case for mathematics or science, there's something called modeling. I'm sure the director of Manifesto implementation has interacted with such a concept, where it can work in finance, it can work even in public health, to say, if we have this number of people in Kampala by day, and we have this number of people in Bundibujo by day, and so on, what does this mean for our transport system? How many people travel by taxi every day? How many use borders per day? Based on these models, what is going to be, how should we approach this issue? There was a case in South Korea where I invite our viewers to read about that case. I think it was patient 49 or patient 50. The lady who attended a wedding, then attended a church service, and her single actions as an individual led to the outbreak in South Korea. So, where is that information? Is this in fact being done? And specifically to Uganda, how far have we gone with testing? We used to see updates of numbers. That has long since faded from the public domain. Can we with certainty establish how many infections we have now? What are the things like comorbidities? How much contact tracing? If you find that Karamaji has contracted the novel coronavirus, how many people did he interact with, a week, 2 weeks to the confirmation of that infection? And can you trace those people? It's not so much about declarations, proclamations, roadblocks, threatening people and all this. It's not working. And so the case for science should be made, in my view. That's another addition that should be. We should actually have, I already mentioned the Uganda Virus Research Institute. Those should be the people who are prominent in this response and leading the response. They've managed cholera outbreaks, they've managed the Ebola outbreaks, they've managed other outbreaks that we've had in the country. And I think there's something we can learn from them. West Nile virus, Marburg, and all this. I do not see those resources being put to use. All I see is one individual sitting at the helm of government, making declarations based on a few graphs, and then making declarations that are going to come back with no effect on the situation we're faced with.
I think, Karamaji, I remember some months back, Dr. Museveni came out and admitted that they lost it on contact tracing. So I don't think it is an initiative or something that they would want to really go back to and invest the resources onto, because they lost it.
Yet that's where the investment should be made. So we have the privilege of having Ugandans like Dr. Ian Clark, Dr. Mbonye, Dr. Olive Kobsinjo, who have written extensively on these questions, and even Dr. Museveni on these matters. These are the areas that they all make recommendations about investments in. And so if we are to have an effective, and not just effective, but coherent, because there's a question of coherence. If you say, let churches be limited to 200, how many churches are in this? Let's not count, let's leave Uganda, let's leave Kampala, let's leave the divisions. Let's say in the area we're having this discussion, you find the public, that's how it gets back to public health, the public planning and urban settlements. You have a church here, you have a factory, you have a school, you have a residence, then you have a hospital, then you have a garage, then you have, so it's chaos. If you say 200 people in that one area, you are endangering way more than 200, as Monicah pointed out earlier. So for me, it's a lot of, I don't know if I should use the word gymnastics or acrobatics, and gambling, and hoping that somehow we emerge from it safe. Yet we have the brains, we have the money, we need to put up the institutions that would guide us through this situation.
Okay, maybe
A manifesto man.
from that point where Karamaji is talking about, of course we've had.
Demian, I'm sorry.
Yes.
We have ministers, we have an elaborate structure for the Ministry of Health, including primary health care, we have the senior minister, we have, and it would be helpful. And there's even a unit in his office, in the presidency, health monitoring something.
Unit.
Yes.
It's outside the State House.
It would help to know, for all this money that we give our friends in charge, where are the results? We see Kenya has been able to open schools, the Zambians are running the public transport systems and so on. What's the case for Uganda?
What's the case for Uganda? It's a question that Karamaji is asking, and also.
Well, I think what Karamaji is raising is for all of us.
Yes.
As a panelist, I don't think he's targeting me as well.
Yes,
Yeah.
true, and that's why I want to just zero down and try to get the confidence that possibly we have the structures that would ensure that this is implemented.
Let me say this, Damian, that I wouldn't want to say that Uganda's approach to this program has been unique. And so it's not about an issue of presidential directives or proclamations or whatever, but what we have seen on the way, even globally, how this problem has been approached, there has been like, it's maybe would I
One
say,
script.
kind of executive coming in to rally their people around a cause, a threat, and then giving strategic direction. And it's not that these institutions, as he's talking, they do not also exist in these countries. We have seen, even in the neighboring countries, press conferences being called by the leaders of these countries and trying to give status reports, giving directions, and other related information that may lead us on the management of this problem. I would always say that probably this problem being unique in its own way and the way it attacked. Maybe like Sir observed, we never knew it was coming soon. And I would also say we need to blame ourselves. Probably we didn't move faster in terms of thinking and probably how we should prepare in that respect. And we looked at it as a problem that was still far. So by the time it got here, and actually the time they even announced that we have tested the first victim, people were so taken aback, and it was like everybody was seeing death knocking to his or her door. So, and if you remember, even in that first address, when the president was like saying, he was trying to bring in a military strategy in trying to manage this kind of situation. Not that it was a one coat fits all, but he was like, in some of these circumstances, if something hits, you need first to kind of lay back and appreciate what is it. Is it a rat? Is it a human being? Is it a dog which is passing? They use that tactic wherever they were. Now, I think in the same respect, first of all, even the developed countries were having challenges in how to manage this problem. Nobody was coming out with what could be the best way to manage, apart from a lockdown and the standard operating procedures, which we are trying as much as possible to reduce contact, physical contact, and then emphasizing hygiene, which were really simple methods to apply. But now the other issue was building capacity in terms of management where the problem has attacked. The problem is here. You are infected. So how do we manage you? I think in the circumstances there, we did not move smartly in terms of addressing the capacity in the health infrastructure, capacity. Of course, the issue of vaccination also had a global aspect. We are told that even as we are preparing to acquire, then the waves were hitting these source countries worse, and then they had fought for purposes of making sure that their systems are safe first. And I think the president has been very, very bit about this, saying these people are a bit selfish because they are looking at themselves and the whole global humanity race. So I want to agree that one, in terms of capacity, in terms of running fast and be able to prepare, to manage when the problem is here, there we didn't move well. Two, we cannot also dismiss the fact that in one way or the other, the way the president has been guiding and the way we had moved, we had also, it was also a good containment strategy. I think as we went along, what was a challenge is that this was posing an experience that we had never gone through in life. You know, these are experiences where you are like in a war, but here you are in like a given kind of normal situation, but giving you demands of behavior that you are like in a war situation. Now, people...
Maybe Chairman, just to add on what possibly Karamaji was also trying to bring out, that like we were saying that this, also Sarah hinted about it, it came as a fast hit on literally all the countries.
Yes.
But literally to us, it is seeming like we've not moved any inch. Is it the issue of preparedness? Is it the issue of the governance that possibly we're not able to catch up very fast?
We can't say we have
because even our neighbors, we see our neighbors have moved almost a step faster than us.
We can't say we have not moved on because there are people here who still have life. And some of it could have been saved by the few strategies that have been put in place and have been emphasized. So we cannot dismiss it totally. Maybe it is not giving us the ideal way we would have moved accordingly, but we cannot dismiss it. Say we have not done anything that should have saved our people. Yeah.
So, Karamaji wants to say something, then I bring on Sarah.
Yeah, I'm curious. The permanent secretary in the Health Department Ministry has complained publicly about how she has to go holding a begging bow to different ministries. And they all say, we don't have allocations. She's made that complaint. She says, whereas there's a perception that all the money has now gone to health, we actually do not have funding. This is a public statement she's made on radio shows and television programs. But more from an official perspective, if you look at the budget that was for this financial year, 21-22, and you see allocations to health, particularly on workforce, issues of nurses, because those are the, even before doctors and so, these are the people at the front line. Nurses, in terms of remuneration, recruitment, retraining, and personal protective equipment. We don't see the needle moving to address the threat that we see. So, are we, to use an expression that young people use in this city a lot, is are we kuteka sente wetulaba? It appears that we are not putting our money where.
Well, let me just add and say that I think we read from the same page, and that could be something that could invite to scrutinize further. Because as far as we are concerned, these budgets or budget frameworks or plans, work plans, were submitted and they were equally supported in terms of appropriation. So now, what he's trying to raise, and probably what we need to find out, is whether those appropriations went to the right use according to work plans. Because I was even seeing the other day where national medical stores, where it was claiming that, you know, money that was supposed to have come to buy vaccines, they have never seen it. So I think that's a different matter for that. But to say that the country sat down and said that we need this, and you move the right steps to make sure that either you borrow or avail resources to make sure that this is availed, that was done. Now, if that wasn't done, those are the internal mechanisms that should be scrutinized further to see why was this not done. But I think from the strategic perspective, the intent of making sure that the country plans and moves in the direction of making sure that this is availed to be able to achieve that, that was done. And I am not here to point fingers here and there. Yeah. But I can only say these are areas that can be open to scrutiny and find out what could have happened. If the planning was this, budgets were availed, what happened to that?
Sarah, you would want to make a rejoinder, but also on the issue of surveillance, just reading from what the President says, enhancing surveillance at the airport and all the 53 land ports of entry, government will establish testing facilities at the airport and all landing border points of entry. In the interim, not more than 2 weeks, the private laboratories will continue to test the incoming travelers. But just I think a few days back, we saw the Ministry of Health coming through and saying that they will be, for example, for Entebbe, they will come and step in and take control of that. But now we are seeing a reversal here that the private entities will be given the go-ahead to do this work. Won't we see a mix? Yeah, that's the interim of 2 weeks. So what will happen, because then there was supposed to have been a reduction in the fee for the travelers, because also the tour operators were complaining that the tourists have actually cut by almost 90% of the entry into the country because of this challenge. But we're seeing it going to happen in the 2 weeks, and we're not sure whether even the 2 weeks will have this in place.
You know, some opinion leaders in this country have said that we are a country which moves by try and error. When trial fails, then error sets in. So, I don't know what is happening. Real at times you get defeated. Just before COVID broke out in the whole world, there was SARS, which is a twin brother of COVID, 206, 207, and 208. Some countries that were greatly hit moved and set up, like in Thailand, an epidemics management authority. I don't know how, if a crisis has happened, and this information is available on the internet. So I don't know whether our leaders are slow in terms of applying the technological advancement and the, benchmarking just on your computer, see what should be done. I don't know how they do research. Because if we failed, I know countries in Africa have moved to legislate a COVID special, COVID management and rapid response plus restrictions act like in Kenya and so many other countries. Because one of the complaints that the Ministry of Health has also advanced is the procurement, saying that the procurement procedures blocked them from acting in time, which I really find funny. Because for such a national crisis, if somebody came to Parliament and say, I need a waiver of this provision for this purpose, I don't think such a waiver would be denied.
Never.
And I really find it a bit lousy for a senior technocrat to raise such
In the radio.
issue as a problem in fighting a pandemic. But away from that, we have seen the report of COVID funds, how they were mismanaged in the first wave, including security agencies. I know most of us, we focused more on the Ministry of Health, being the ministry in the spotlight. But when you look at procurements by police, the accountability they gave, you can only cry for your country. So I don't know. So in time when we needed speedy action, error set in. From our try and error approach. Error was in overdrive, including the money that we spent for, classified expenditure, security, as if COVID was like Uganda had been attacked and the money must go to security to protect, secure the territorial integrity of Uganda. Biggest chunks of money were approved for security, for State House, for COVID management under the first phase.
Damian, I really think we should, as citizens and taxpayers, press this point more seriously. We have a constitution. Okay, it's a beleaguered constitution. It's embattled, but at least we have a document called the Constitution in this country. It stipulates how you manage certain situations. Academics like Businja Kabumba have extracted that provision, I think it's Article 110, and written extensively about it. What should have happened in light of this public health emergency or pandemic. All this was thrown out the window, ignored. We relied, I don't know how many times people made this point, we relied on an act that did not have the breadth, as the Honourable Member has mentioned, that did not have the breadth to cater for a public health issue of the magnitude of the coronavirus outbreak. And a year later, a year more, over a year later,
And a half or so.
and a year and a half or so, we do not see legislation being passed to fill those loopholes or even going back to the Constitution for guidance. We can forgive painfully what happened towards the election and so on, because for partisan political, that will take us to a route that we might not be interested in here. But what do we have to learn from the Constitution? Why don't we consult? It's already there before we go to trial and error. Just consult the document and it will guide you on what to do. To lock down a country, to declare a curfew, to undertake all these major efforts is an emergency. So, and their provisions, how is it possible that our friends have not consulted the document to seek directives from there, as opposed to ruling by decree and administrative fiat?
I think so. But
When I first came in, when I was speaking, I think it's important also to note that the executive is hiding behind the draconian Public Health Act of 1935 and using it to amend the Constitution, building on what Andrew has said. Because if you suspend freedom of movement, how do you suspend it? You must suspend it within the provisions of the Constitution. But now we are using the Public Health Act to regulate on curfew, which is affecting freedom of movement. You are using Public Health Act to regulate and lock down professions To amend Article 40, 41, and 42 on professions and employment and freedom to earn from your profession. At one time, we had a debate, and maybe because viewers could be wondering and saying, okay, so if this has happened, what have you done? You know, in the first phase, Uganda was so much praised for having effectively managed the pandemic. But World Bank has authored a report that vetoes that praising by saying that for every life we saved, we lost 4 lives.
In Uganda.
Because of the high-handedness of security. But away from that, we had a debate when South African lawyers had moved to outlaw the COVID guidelines put in place by Ramaphosa without following the Constitution. And the Constitutional Court agreed with them and told Ramaphosa he cannot become a legislator because of a pandemic. So lawyers debated and said, okay, can we go to court now? We even have a precedent on the continent. But given that praise and hype, some of the public interest lawyers said now citizens might look at us as witches when even there is no death and what. And that also because if you are litigating in public interest, what was the public interest? Public perception at that moment. Was it that of saving the Constitution, or it was that of praise for controlling the pandemic? So we failed to proceed on public interest because it did not exist among the citizens.
Yeah, thank you very much, Sarah. And you, of course, Andrew, the issue that I also wanted to bring about is, of course, the president you talked about cabinet fast-tracking the issue of the Public Health Act. And now the issues that have come out are contravening of the other rights of the citizens. Where possibly does this leave the parliament? Because really, it has somewhere to start before the cabinet then comes in then an executive order like that.
Demiano, I think that what we need to interrogate further in this matter is that who is the beneficiary of the crisis? Because in every crisis, try and error. First, who is the beneficiary of the crisis? And of course, then, what are the interventions that are adopted and to which end? And
because I'm seeing there is facilitated enforcement of SOPs to include, among others, the on-spot and court fines of those who fail to adhere to the SOPs. So I think those are the ones that possibly will be...
Well, like I said earlier, that Ugandans have been so good as usual by abiding to these SOPs amidst a lot of hardship and pressure. And when I reflect on this matter, of course, certainly there are beneficiaries because a crisis of this nature, in any crisis in society, usually there are beneficiaries. And of course, the agenda setters usually will have the end game to the matter and they know what they want to achieve. And that's why I was asking that it looks like there is a script from which the president is reading and he tries to implement every item on that script to the dot with the fear actually of, going against perhaps what is on the script. And then you wonder that now, if there is a script of that nature, well, I don't even want to go there. But generally, when we look at the way the strategies or the try and error approach Sarah talks about, in the end, there are people who are benefiting greatly from the extended lockdowns, the try and error approaches which are being implemented here and there to the detriment of the majority. I think what Ugandans yesterday expected the president to address was the reopening of the country to allow everybody to enjoy this country amidst the challenge, the crisis that we have. Of course, we don't want to underestimate the impact of COVID and the importance of staying alive and keeping everybody safe. But the implementation of the strategies adopted, because yesterday the president was saying lockdowns are based on assessment of 3 issues. The vulnerability of the sector, which is either to be opened or shut down, the level of risk, and transfer of the virus to the other people, and also the economic impact. So when benefit or impact. So if they assess all that, that then guides the country on whether to reopen or to continue with the the shutdowns. And as it is right now, many people are panting. Actually, they are hard-pressed. If you look at the education sector, I was having a conversation with some of the teachers who teach our children. Some of them have abandoned the teaching. The private sector says the teachers in the private sector have not earned a salary for the last 1 year, plus it's coming to 2 years. And after this lockdown, we may have a risk of having no more teachers going to the classrooms, especially those. And no schools, because the level at which schools are being sold with no remedy, no, what were those called? The monies Parliament was releasing here and there to support the incentives for the stimulus package. So at the end of this lockdown, how is Uganda going to look like? How is the education sector going to look like? How are our children going to be like? More than 15 million Ugandans. And so the balancing effect that the president uses, I think he needs to be advised again. His advisors are not giving him the right information. The impact on the business sector. If you go to downtown right now, I'm not sure whether some of us, of course, people were saying that we are joining the business sector at a very wrong time, because you go and look at what people are doing, and you're like, is Uganda going to survive? This is the backbone. They may argue that your business is not the backbone of the country and all that, but it is a sorry state. And yesterday we looked forward to that declaration from the president that, the economy has to, because you have to balance. The risk at which we are having to keep the country closed vis-a-vis the livelihoods of people lost, the future of children destroyed, and then the arguments made are not very satisfactory, because the children are going to reinfect the parents, and the parents are going to be let free to go and work, to do other things, and then when they go back home, they are not infecting the children who are locked up. So those kind of arguments, I think our country is really going through a very difficult moment, and somebody is taking advantage of the situation. And when I look at the sectors which are being opened and closed, there is an assessment on them. Who is the interested party in this? The construction industry is still working full-time, and a lot of constructions are going up, and you wonder where are these ones getting the money. So there is certainly...
High-scale bars are open.
High-scale bars, back doors are open. So generally, the children who are suffering also are not for an ordinary Ugandan, because those who can afford are having home study. Those who can afford are having their children in international schools. Then who is talking for these people? And they have no voice. And, sometimes when you reflect on it, you're like, well, this Uganda is all ours. The try and error is going to take down so many. And I don't know, the advisors like Mr. Bashasha here and the team that advises the president there, whether they don't interact with the ordinary Ugandan on a day-to-day basis and have a feel of what they are going through. So I think for me, sometimes being invited to talk about COVID and all that, I just had to come because it's a duty. But it's not a pleasing conversation, because you know that no matter how many things you're going to talk about, it's as if there is a script which is being followed, and that script is only to the benefit of a smaller percentage of Ugandans. The majority of Ugandans have to tag along and live along whatever is being decided by the majority. And unfortunately, Parliament looks to be hopelessly looking on. You release the money, and the money doesn't achieve its work. Recently, we were excited that now Mama Nabanja, who is a very good friend of mine, she's a very result-oriented woman. But she has come to a system where eating is more important than the working, I think, and the service delivery. Yeah, and so she's a captive of a situation that she cannot change much.
She came in from
and so
transfers, so now
and the money was ending up somewhere.
And if you're not yellow,
she doesn't trust the system. Now she has to give the money directly.
No, let's have a short break, then re-energize, then come back after this. Yes, dear citizens out there, kindly, let's have a short break on this. But follow this conversation. It's live on our YouTube channel, Civic Space TV. Kindly subscribe there. But also on Facebook Live, we are streaming live. And on hashtag #ChatShowUG, the Twitter hashtag, please be part of the conversation that is happening there. And we see how best we can go over this pandemic. Let's have a short break and return. Welcome back from that short break, our dear fellow citizens. And like I was telling you, kindly follow this conversation. It's live on our YouTube channel, Civic Space TV. But also we are running live on Facebook. Kindly be part of the conversation. And on our hashtag, ChatShowUG, be part of the conversation. Kindly post your comments, your reactions. And let's have this conversation widely and as far as possible. So we're just trying to, of course, understand and also make our input into the presidential address that happened on Wednesday. And here we want to see on the issue that we're tackling, we first had to talk about the immunization, vaccination. And on the panel, I'm joined by, of course, Andrew Karamaji, Sarah Bireete, Willis, and Monicah, who joined me today. And we want to go to the third issue. The third issue in the points that the president talked about was the issue of reopening, safe reopening of the sector. And in there, he hinted on three issues that are really the best one to ensure that the sector is reopened. Of course, they said scientific evidence-based approach for safe and sustainable reopening in a phased manner, enforcement of the SOPs by the sector in line with the COVID-19 statutory instrument, then increased awareness by the sector of risks and adherence to SOPs. But also in there, they say that the task force usually considers a number of factors such as risk of transmission in that sector, vulnerability of the individuals, and the overall economic impact in that sector. So while we're in the address, of course, we saw some areas, some sectors being opened, like the churches. Of course, they were opened with 200 people in there, but also they also, of course, including burials, then the weddings. What possibly would want to ask, and I would want to put this, maybe let me start with Amoding. Since we started from there, let me start with you, Monicah. We, like in the previous reopening, especially with the arcades, we saw the opening happened, then the follow-up on SOPs, maintenance, and following the SOPs came later. I think that's where Sarah was talking about try and error. Mm-hmm. We are seeing the same happening in this second reopening phase, where the school, the places of worship are open, the casinos and these other places are open, 200 people. And we've not seen a process of ensuring that these sectors, these places, have SOPs, checks have been happening before the presidential speech and also before we could have this address happen for reopening. Shall we see, or do you think that these sectors will adhere to these SOPs?
Well, I think Ugandans have tried in the circumstances, and largely because of the scare in line with the healthy living generally. Because of the impact we saw, the first wave was not so bad. The second one is where everybody was shaken because quite a number of people died, and people took it upon themselves to, respect and honor the SOPs. But given the time frame that has passed, it is over a year and a half. The first lockdowns happened in 2020, around March. And people were locked away from general public life. Mm. By then, the government would have come up with specific laws and regulations and ensure that Ugandans are asked to follow. Because then without those enforcement, without the laws, enforcement is a challenge. Because at the moment where we are at, it's no longer about anything, it's about the enforcement of these SOPs. And enforcement would rather come with a clear regulatory framework in terms of what happens, other than the curfews we have from 7 and till morning. We need to have a specific law that talks about what has to be done and what happens where there is default, and that detail. So short of that and lack of those regulatory mechanisms, which are still in the offing, because there has been an instruction to Cabinet to do more work around enforcement of fines and those specifics. So I think that the challenge is going ahead of the cut. because the time when we were in the lockdown, the 2 months, that is what the 11th Parliament would have come as a priority to undertake. The first line of duty that members of Parliament would have come in with, because as soon as they were sworn in, then the second wave also came in. And so by the fact that they were already sworn in, they should have focused on legislating around enforcement. And now you're reopening the churches, you're reopening different sectors. But when somebody defaults, there is nothing that happens. And so just running after these people, I know that because of the curfew only, people fear curfew more than anything because it's the military, the red tops who are there, and they will beat you to tatters. That's the reason why they run home before time. Other than that, actually, I think that individuals have been just trying to enforce these regulations. And so it would go a long way if there was a law which was working hand in hand with the goodwill that the public has to honor these SOPs. But by and large, I believe that without stricter measures in terms of, enforcement, it's going to be difficult to still ensure that people honor them. So I think that maybe going forward, for me, my prayer in coming to this discussion was to really talk about the need to open the economy, to open the country generally, and allow sectors to thrive alongside SOPs, because the more the country is kept locked down, there's a lot of torture and suffering economically that people are going through, and it's not helping in any way. So we may be looking at the health framework, but avoiding the other long-lasting economic impacts and others to other sectors, which is detrimental in the long run.
Okay.
Yeah.
Thank you very much, Monicah. And Sarah, maybe also to get to you, you had an earlier issue that you wanted to comment about at the airport and the ministry coming in. But also, Honourable Monicah just says that there needs to be a strict adherence to these SOPs and enforcement of these. So my question would be, shouldn't it be a first that we all these sectors that are planning or being planned for reopening should first ensure or show the readiness before being announced? Because we are going to see a situation, of course, where now the RDCs and the other law enforcements go for these other places that have not enforced, but also we also know that there are those that will break these SOPs but will not be really affected.
Demiano, at the testing at the airport, at that beach, what is it called? That beach where there is testing for COVID.
I don't know.
The beach hotel.
Is it not
Beach hotel. It's some facility, yes, hotel.
Imperial Resort?
No,
it's a different name. Okay.
It was so depressing. You know the excitement everybody has coming back home. Yeah, and then you come home. Of course, through the airport and the immigration, it is smart the way they check temperature, the medical forms you filled. Now they no longer check the temperature. They just look at your forms and passports where you're coming from. Then you, through the customs, you find, when I was studying marketing, which is my first discipline, yes, my first discipline is Bachelor of Commerce.
It's strange.
Marketing.
Actually, the marketeer. If you didn't know.
Yes.
I don't agree.
Professional.
Yeah, when I
in the second
studied
one.
marketing, in advertising, impressions are very important. But even in life, first impressions matter. So you come out of customs, if you are a visitor and you are welcomed by villagers, I don't know how to explain. I don't know how to explain the kind of handlers that were put at the airport for this testing. All the other handlers, you are from these professional hands, immigration, customs, then out of customs. You can get depressed for a week. We all knew the 10 countries that were for testing on arrival, including Kenya, South Africa, Dubai, and other countries, India. And with the exception of India, the rest were the unvaccinated. So people who traveled and were not fully vaccinated and had gone to these countries knew very well that they would test on arrival. So what you would expect from a smart country is to say, out of customs, this is a line for Kenya, this is a line, you name the categories. Kenya, South Africa, India, you are passing here. Other passengers, you pass here. You just create two lanes. Then out of these two lanes, you know automatically, these are people, if not fully vaccinated, they are for testing. And they continue so that you create proper movement. But they created like a crowd. So everybody's in the line, people putting luggage, including children who are not eligible for testing. And then you reach there, people are reading. Let me give an example. I was following a professional colleague from Tanzania who had traveled using a national ID because of the East African protocols. So the person received an ID and said, why did you travel with an ID? What is your passport? Get off the line. I was like, how can you get such a villager and put him at an international airport?
After the
Who doesn't even know that East Africans can travel with IDs? And he's at the international airport. So maybe that can explain the kind of disaster.
At the airport.
Yes. Very semi-literate people who don't even have basic immigration knowledge. They are the handlers at that airport. Then out of that chaos, you are welcomed by SFC. Bring your luggage, bring it. A clear military operation. Yet people know they have to test. They have to be transported to that beach where they are doing testing. But then you have the military. I used to tell them to calm down. I used to tell them that my health is my primary responsibility. They shouldn't seem to be more concerned on whether I'm healthy or not, because I'm more concerned than anybody. So you are putting that bus to the hotel. At the hotel is another crisis altogether. The tents, very shabby place. Not, even you as citizens, you get embarrassed and depressed. So I don't know what impression it would give.
You should be addressing the permanent secretariat.
And so that's why the tour companies were up in arms. And I understand really their concerns, because I've experienced them on a number of occasions. But away from that, the exorbitant fees. $65, it has now been proposed to be at $30, but I heard the other day in Parliament that these testing companies at the airport were all owned by members of cabinet.
Hey.
Yes, some by members in the ministry, others by another powerful minister. Test and fry, then whatever, one day, same day, result, same day. Then, then Parliament was asking, how were they selected? Of course, part of our people who benefit from the try and error. So those are the challenges, really. I'm glad that there is a proposal to set up a testing place at the airport. Airport has enough space, including the old airport.
Yeah.
Why you can make it a testing place? What is it at the old airport? We all pass there. There are a few grounded planes. Enough open space. Make it a testing ground. Why do you bother people moving in, maybe.
Wow. But Entebbe general is depressing on arrival.
Getting to the issue of the adherence to the SOPs and the opening up of these other spaces before ensuring that these facilities have been put in place.
They said they haven't put them in place. I thought they had, the first directive was that the private companies stop by 30th September.
And government takes over.
Takes over, but now the president said they are giving them 2 more weeks. And given the people who are involved, including one of the powerful ministers, former ministers close to the president, the interim period might become permanent period. I hope it will not be that.
Thank you very much. It's quite regrettable from Sarah's narrative. I have not had the privilege of
traveling.
for a
For
while.
like 2 years or
Yeah,
so.
but I get sometimes we read these stories, we pick these stories from friends who travel. You were raising issues to do with
The reopening?
Yeah.
Yes. And,
First of all, I want to say that in some cases, the decisions that are taken, much as they come through the directives to the executive level, are a work of some consultative process below. An activity which is coordinated by the Office of the Prime Minister, because we have a national task force in that respect. This, I will only say that probably we could have had a science-biased approach
Team.
leading to probably some of the decisions. I'm not a member of this, but this is what I read.
And not the politicians.
Well, I could say that probably we could have balanced by also trying to look at the socio-economic impacts on the whole aspects of the decisions, or the scientific, socio-economic impact of the decision that will be made. So that in this respect, there is the balancing effect, like Monicah was saying, brings out the concerns of each and every effect as we go into the implementation of these decisions. Secondly, there is also what Sarah has raised here, the issue of your health being your primary responsibility. But here in Uganda, we also have this, I don't know whether Sarah will agree with me, because I think democracy has also become too much. Yeah, too much freedom, and
Do we have
I don't also want to know why would people want to leave their health for Museveni. This is a problem.
Why doesn't he leave it and we see what happens?
No. You see, at leadership level, there will always be that intervention. But it's like, why would we want to leave our health for him? Because that's why we end up causing all this noise of blaming him. You know, you did this, you did this. We are waiting for your directives. Your directives are like this and this. But I will also say that largely, this could be a problem we could manage through discipline. As citizens, as people who really take much care in the points she was raising.
Can I give you some little information?
Yes.
You know, at the beginning of the second wave, in the first wave, the presidential addresses, you know, which we used even to say the show, people took in the message, especially the young people. So when they announced the first death, my youngest son said, but how can people be stupid? The president has been on TV begging everybody not to die. What has happened to these ones? So that he had got the message.
Yes.
But at the beginning of the second wave, when he addressed, he looked down and said, I have told you, we all know what to do. If you want to die, you die. Didn't everybody start wearing masks in town?
That's what I'm saying.
Yeah.
So in the same respect, I think we also need to, as citizens, and to me this is my message. You know, Monicah had her message. My message is us as citizens. What sense do we pick from these guidelines in as far as our personal protection of life is concerned? It's not about whether we have received directives or not. Of course, directives will be there for purposes of cohesion, for purposes of, agreeing minimally on how we can move in a way on how to achieve what we want to achieve. Because if you also leave it that, if you leave it to the market and say the discipline will be on supply and demand side, we may have a lot of uncoordinated movement of troops. But to me, I think it is high time, like now the vaccines have come. Why don't we go and vaccinate? You know, that's something that we don't have to say
wait.
that we should drive pride or be commenting that, hey, the president said he's going to sack a cow, and then it becomes a subject matter of debate. No, it's like the vaccine. Actually, what we should put to the executives that have the vaccines been mobilized, we want to see them down here. Where are they? Then we go and vaccinate, and then we are able. And then from there we can say, Your Excellency, you were targeting 5 million because the vaccines were available, have been vaccinated. Why are we still in this kind of lockdown? So to me, I think we need also to shift that citizenry responsibility in as far as some of these...
But you need to tell the citizens the right information.
Yeah, the information
That's just holding them to go and get vaccinated without the right information.
I think the issue of information, we also need to see which information is coming through and from where. Because most of the information that is coming through that actually has also been a source of confusion is uncontrolled. This is social media. Some are trade wars, some are for whatever reasons, some are to do with our thoughts, some are to do with our beliefs. You were giving us an example, nobody came us. For example, that person who died, we are not sure whether he died of COVID after being vaccinated or what. It's just a speculation. But if it is propagated in a manner of frustrating what is going on, it will be taken in as gospel truth. So this is what I'm saying. To me, is like, as citizens, government has said vaccines have come down. Let's go and vaccinate. And then tomorrow when they release a report on the statistics of vaccination, we say, government, where are we still in a lockdown when we have been able to achieve the target of the vaccination? We have reached the hard level whereby now we can be able to maybe survive on the immunity of the others that is there. But you see, we have a situation. Vaccines have come. As citizens, we don't want to vaccinate. We are also saying, why are we in this? You know, I think we need to move.
I think the issue is on
yes, and my coming here, that's my point. So Monicah had her point. That's my point. How does the citizenry take up this personal responsibility initiative in making sure we take up this guidance and we see where it leads us, and then we now put tasks to government on its obligations to make good of why we are in a lockdown. My submission.
Thank you very much, Willis. Andrew, give your thoughts here.
It's a question that Willis's articulate submission has raised in my mind, which is what is the understanding of the people who are in charge of this society, of the very society that they lead? Because I think there's a variance between what is on the ground in fact and the things that they declare in speeches or on paper. When you say, for example, let churches open, I don't know if churches included mosques and other forms of temples and so on.
Yeah, places of worship.
This might seem like it might seem like a hilarious question, but what is a church in the Ugandan context? You would hope that our leaders or those who advise them have such information. Does the opening of church mean and include all the ones in using papyrus leaves, the ones using iron sheets, the ones that are established, the ones who are registered, the ones who aren't registered,
and
the ones who fall under open air? If tomorrow we hold on this road, we say we've blocked this side, we've talked to someone, we put plastic chairs, that's a church. Tomorrow we have
the crusades
in this city.
You mean the crusades?
Yes, we have crusades. We have people who move from one stadium to another. This day the fellowship is going to be here and so on. For me, if there's no clarity up to that level, with the level of investment we have in intelligence, and that might make us now go into an area we don't want to debate here, but I think the priorities are different and are not what we say they are on paper. I'm yet to understand the logic behind this 200 people limitation. If you consider that I'm not going to fly to the church, if I pray from Kampala Central, there has to be a journey. How is this person get? There are questions that have not been answered, Damien. And so I would like to say, if my colleague here talked about being strategic, but I think our leaders are tactical. They are living day by day. Like us, they also don't know what will happen to. They don't know the end game. They can't with certainty tell you that by this time we will have resolved this issue. There's a sense of
Try and error.
I guess that's the same point. Or to put it in Uganda, echija chije. We shall see. There's no sense. You don't feel. I don't feel led. I don't feel safe. I don't feel catered for. Okay, we have personal responsibilities to go and get vaccinated. Where from? Can we attempt a hypothetical situation here? What's the population of Kampala? If it takes, estimation, 10 minutes for one person to get vaccinated, from the time you walk into the health center and you leave, 10 minutes. If we gathered all Ugandans in Kampala and said, the vaccines are here, let's go and get vaccinated, before the expiry date, will it happen? No. If it won't happen, is this directive that has been given feasible or not?
And its implications on the other directives.
Yes, and what that means for the others. So there's a sense of, indeed, try and error, as we've said.
Maybe because when the government, like they say that they need to partner with these, especially the churches, to ensure that they push people.
Yes, but then if I may say something,
You see, me,
you know, I
Yeah,
saw
civil
comments
responsibility
coming in
together.
on Twitter that there's a requirement for a national ID
Yes,
to get immunization.
it has been happening. Yes.
I don't know, is that to establish citizenship? Because not every Ugandan has an ID. And some of them have been stopped by technical failures. We saw the crisis of people who could not vote. So now when you say without an ID, you will not be immunized, people who turned 18 2 years ago, have they gotten their IDs?
think they have.
And we are saying from 18, immunize.
But I don't know whether that's an established condition.
Yeah, because as you fill the form for immunization, you put your NIN number, but also,
I think it is for a reason. Because this goes into a database which should be
yes, but
data for
what,
verification.
okay, but what are the, now what happens to somebody who doesn't have an ID?
No. Well, these could be the challenges to it, and which could be discussed at operational level, and then they go up and see whether that's really should be a mandatory condition or an option.
But also, Sarah and Andrew, the number of vaccines already in the country, it has taken government all this time to mobilize 11 million doses. I think 11, what did the president talk about yesterday?
Of course,
And that's by the end of December, we have only 2 million. And then if everybody now wakes up and accepts to go and get vaccinated, I don't think we are able to meet the demand even then.
But I agree with Wills on that point. Let's consume these available
Which ones are
vaccines
there? Yes.
and finish them and demand for more. But now you cannot demand, even when vaccines are expiring.
Exactly.
Damian, there's another point on a government, quote unquote, I use that word loosely, that is present when you least need it and absent when you most require its presence. We've seen coercion being used in certain situations that don't require coercion. And then we see a complete absence in situations that would require government's machinery to be marshaled to move to support issues like on public health. I have a little story that might interest our viewers. I'll summarize it. Years ago, a trailer, a haulage truck, ran over a public service van, matatu, taxi, and people were trapped under the wreckage. This was near the home of a popular politician. And people began calling for ambulances and medical help and all this. It took 4 hours for a response to be given. Months later, at the same location, this politician threatened and said, tomorrow, I'm going to walk to my office. I'm tired of being locked up here. By 5 a.m. that day, there was a full deployment. When there was a health situation, it took 4 hours for a response. When there was a question of freedoms and expression and so on, and movement association, there was an immediate response. So this issue, and I'm directing this to my elder brother, of saying it's your responsibility on some issues. Ugandans, go and get vaccinated. Then when it comes to the issues where we expect you to be present, you say, passing over responsibility to citizens and then moving away, withdrawing, when it comes to situations where government should take the lead. There's a reason why we save you from paying taxes, why we provide security, why we allow you to overtake on the road. We give you priority so that you take care of the societal issues. It's not for fun that we want you to, there's a reason. You shouldn't sleep. You should deliver. And that's what citizens are asking for. How is it possible that a year plus we're still debating some basic issues in a conversation like this one?
Interesting. Sarah, let's first go to almost, because we are tending towards the conclusion, the issue on schools reopening. Of course, we've had the issue on the bars, places of worship have been opened. We have the markets have been opened. We have the betting places have been opened. But in these spaces, we also have these young people going to these places. But the fear, and what the president said, that once the schools open, then there's a likelihood that, yes, they will give the parents. But in the betting spaces, we have these young people who go to school. Yeah, these are the same young people who go to school, go and do into the betting spaces. But they also visit the markets and they visit these places of worship. And, but we still have schools closed and these places are open. How is that really, how do we fit into that?
I did ask at the beginning on what kind of research
was done.
The task force on COVID does, or our policy and decision makers do. We all know the mistake made in the first phase of schools reopening. Absence of surveillance, concealing information on sick children. I think those were the two major mistakes. Children are sick, there is no measure on how to handle them, then you conceal information, and then there is no surveillance from the district health team and district education teams. They've been closed now for how long? For about 4 or 5 months?
Since when?
Or 6 months.
Since May, still.
Yeah, or whatever, around 5 to 6 months. So what, in these 6 months, what have we done to rectify that mistake? Make sure the first report of Parliament on surveillance teams per district and money allocated. Money disappeared in thin air and no single surveillance center was created by Ministry of Health, which is claiming it doesn't have money. That is the report before Parliament, where they've asked for a forensic audit. So in these 6 months, what has the Ministry of Education done to rectify those issues and come and tell the task force, this was a mistake from my sector, this is how I have addressed it. I have said on several platforms that there is no leadership in the Ministry of Health.
Education.
Especially when it comes to education, when it comes to management of COVID pandemic. And that also comes into the whole picture of lack of a national response plan. Because if we had a comprehensive plan, which says sector A, you must do ABC, report back. Sector B, you must do ABC, report back. And people verify whether you have done what you are supposed to do as a sector. We wouldn't be in this zigzagging kind of situation.
But if I may first finish
briefly. So if we had set up, I have seen in the new directives, there is that directive on sick days in schools, which is good. But must it take us 6 months? Because what you need is check the sick base in boarding schools, ensure their antigens. Antigens are cheap to acquire. You go to Parliament and say, this is a supplementary budget for antigens for testing in schools. Then which can then be followed by confirmatory tests.
At the health centers.
What I wanted to differ a bit was that if you are very much aware, is that the issue of reopening schools debate has been on, and the president was solo on taking a decision. I think basing on the facts, probably what Sarah is raising here, maybe the teams that are responsible for the issues she's raising here were reporting to the National Task Force, and the reasons were not convincing to allow the schools to open. Maybe now there are reasons to convince that the kind of mechanisms she's proposing, mitigation measures they are proposing, are now in place, or we have the capacity now to have them around, and then we can have the kids go back to school. So I wanted to say, yes, it's important, but maybe that's the reason why the urge to open has not been possible, simply because of the same fears that she's raising here, that probably were lacking in the preparation mechanism.
Yes,
No,
but
but,
my point is, sorry, Honourable, my point is that the same children we think are going to kill their parents are exposed.
By their
You
parents.
cannot lock down, even if you have a gate. Are you going to tell your children that you cannot move for 6 months? No. Are you going to keep them in the gate?
No.
So as parents, and we
We're
exposed,
moving and exposed.
we are here. Won't we go back home?
The challenge, Sarah, I think, and this question was on my mind as I was coming here, the people who advise the president in this country have let him down totally, and maybe Willie is also one of them. The advisory team. And I wonder who is on that committee that is consulted.
I'll take the Barbie in good faith.
Because the president cannot come up with those directives without a consultative process. He must have been advised by several people. And I think these people behind those directives who do the research and guide the president on these directives have let him down. Because the reality is Ugandans would have preferred that this is opened up and we go to a normal life like other countries. Uganda is only, I think, among the 18 countries in the world that have kept their education sector locked. The rest have opened up. In the region, I think it's only Uganda. We are the only ones. And there is no logic whatsoever to keep the country locked in the education sector and others
While losing
out on the other, the fabric of society. It's pathetic. It's not good at all. And we will need to assess the impact of COVID, post-COVID, and see how, our country's structure generally has been affected. But going by what is there, it is not pleasing at all. And they need to do better to advise the Museveni on the man.
Because maybe possibly I also wanted to find out, at this point of lockdown of these schools, we are seeing that these facilities that would ensure that the SOPs are followed, yeah, possibly the sanitizing arrangements, the spacings in these schools.
Training of
training them. Nothing is happening, and okay, if it's being done, then it's a good one. But the fear was that once they open the schools.
Because there is no reason how they would have convinced the president to allow if she didn't know those things are
happening.
Yeah.
That's a good one. Andrew, you wanted to?
I want to further the point by Sarah.
But also, as you're doing that, you need to now give your final parting shots.
Yeah, sure.
As
The regulatory role of the Ministry of Education and Sports in this country. I visited the website and I found it states that there are, since the liberalization in '93, we've had, the account is at 4,000 something schools, private, excluding the other forms of schools. Now, with privatizing education, it means so many things, including the fact that you've released issues of curriculum development, you've put them in private hands or international hands. We know that there are some children now whose schooling has not been interrupted. I have nephews and nieces who are
In international schools.
Yeah,
There is no
studying.
interruption. Nothing.
They've been, they're up to date, and there's a format for them learning.
Promotion as well.
Promotion, you know. The questions are of the Education Service Commission also, particularly pertaining teachers. What is the regulatory role? Surely, even if we have that big number of private schools, does it mean that the education service providers who are private are a law unto themselves? So if the ministry is planning to share some reopening plan, what happens? Is there some sort of rationalization, regularization? Are we going to have 2 generations of Ugandan children in a few years? Now, if we are employers, we will be wondering,
What is the status now?
are you UPE?
Even now.
Are you international? Are you UNEB? How did you, what did you do between 2020 and 2021?
Are you
UNEB?
Cambridge?
What happens to the economy
But
that we
I
are?
think if you are Cambridge, Cambridge has its own assessment. If you are UNEB,
No, the employer. People are about to run adverts to say you must have a Cambridge. Yes.
No,
I
seriously,
think
guys,
they will say you must have acquired this minimum of education. If it was through Cambridge, then
Winding. Yeah, we are into the winding.
And we are
Our
going
time is
to
fast
do a
spent.
compulsory promotion without having,
it's a question of regulation. And I say this with personal experience. I consider myself privileged. I went to Green Hill Academy, and I read a UESO report which showed that in the years that I was in nursery, 94, if you count the 7 years post that we enrolled, we were about 2.5 million. When we got to university output, we were less than 200,000. You have over 1 million Ugandans unaccounted for. This is a UESO report. These reports are released annually. Now, with COVID, if we're already having a low completion rate without COVID, what is COVID going to do to completion rates with the UNFPA predicting child pregnancies, unwanted pregnancies, dropping out, parents dying? It's a major...
And now we have a repeat of the teenage pregnancies. People who got pregnant in the first lockdown
again,
are pregnant again.
the second time.
Yeah,
Yes.
so I'll conclude.
the cycle.
I'll conclude this way. I'm concerned because I have seen it as a young person.
You conceive 2 kids.
The education system we have is exclusionary. It's creating classes of children. We see it today.
Yeah.
I have given you my personal experience of seeing that I am one of the few lucky ones, but it's a sad thing. That's how we might be privileged, but someone hits you with an iron bar. Because this person should have been educated, but for no fault of their own, they didn't access. So my conclusion is this, and it's based on some little consultations I did, that public health should have about 5 elements. One is political commitment, which is not in words. It should be seen that there's actually, interest in these issues. Communication, testing figures, what are the infection rates, where are the, vaccines and so on, what's the plan, timelines and so on. A technical package, we talked about mathematics and science earlier in terms of managing this thing, not a military operation, but even if it were, it should be backed by some basics. Then partnerships, which is a fantastic thing that Ulyss has talked about here in terms of support from other agencies and so on, but which we need to see more of. And finally, the management. I'll say this in passing. I think that the head of state, and I'm aware that other countries are doing this, similar things, but I think the office of the president should be given the dignity it deserves. By the time a head of state comes to give a national address, he must have thorough, up-to-date, he's the biggest consumer of intelligence information. He must have clear data, not to come and say, I think maybe we should. Then he looks aside and says, what is the figure?
How many
Where the
students?
beds
What
bought,
is the number population? Is it 41 million?
we thought before you come to TV, you have a thorough briefing so that we also feel led and feel safe in these issues.
Thank you very
Those
much.
are my thoughts. Thank you.
Thank you very much for those parting shots. Sarah?
I think the way forward, one, I want to call upon citizens, to those who can access immunization, go and get immunized. We have seen how the Western world has been able to open up, get back their lives, including watching football, a free-packed stadium with no masks. Let's listen to the scientists. And for the vaccine hesitance teams, they are like some of us are not presidents. Because if I were a president, I would mobilize enough vaccines and then lock down. Whoever is eligible for vaccination and is not vaccinated, I would tell them it is okay. Yes, I respect your decision not to be vaccinated, but self-isolate. So I would do what Europe is doing with the vaccine pass. I would tell you, stay home. If you are to board a train for Europe, where is your pass? If you don't have it, maybe drive your car where you are on. Don't endanger other people. I would do the same. So please go and get vaccinated. On the issue of learners who are stranded at home, I know that now we have double senior ones. We have double senior fives. And schools like one where Andrew was privileged to go to, senior ones are running. They have finished admission. They are running. They are going to complete their first term. Whenever everybody else is not sure even of the schools they are going to, because there is no official selection, there is no admission, but other people are running. We have created, through this lack of leadership on the education sector, we have created a different class society of privileged Ugandans and maybe people whom we are training to be security guards and maids of the others that have access to education abroad, education in international schools, and high-end schools in Uganda. It is very unfortunate because originally in society, education is an equalizer to balance the unfortunate happenings of people's parentage and backgrounds. But now education has become a disaggregator of what you will become in the future. Very, very unfortunate, and I condemn it.
Thank you very much, Sarah, for those views. Willis?
Me, I want to propose two areas in respect to this because I think COVID has been here. To me, I would like to say those who are responsible for the consultative process, I think we have had enough learning experience from what we have experienced here, and we can also now benchmark because travel now is acceptable. We can benchmark, we can read further and look at how we can introduce best practices on how we can deal with these issues better. So let's widen the scope. Let's not look at the scientific impact of this problem, but also the scientific socio-economic impact of this whole problem, so that we are able to come out with decisions that are balanced in a way as we approach to getting a solution. Secondly is what Sarah touched on and is what I had raised before on the issue of personal responsibility as citizens, patriotism. You see, we can't say we have to love this country because of Museveni. It can't be our health because of Museveni, which I see is the kind of narrative that is being projected, especially after this kind of presidential addresses. The president comes out at that strategic level to give a direction and how to rally us as citizens in making sure that, this is a challenge, this is how we go about it. But I think it is also our responsibility as our citizens to buy in at the earliest opportunity possible, especially if the risk is known, and say, this is how we can also protect ourselves. And we are happy that probably we have even a leader who could come out and tell us this. We also have countries where leaders were shying away from telling their citizens that this was a problem with its associated risks.
The ones that are eating on the street in New York as they attend UN.
Yes.
Because they are not allowed to enter restaurants without vaccination.
So this is where I'm saying citizens, and I would beg,
yes.
and I would beg this TV as part of the media fraternity in this country to add its voice in mobilizing Ugandans to go and get vaccinated. Let's all go and vaccinate, and then we put pressure on government and say, why are we still in a lockdown when we have been able to meet this set minimum target? Why don't we now allow us to be free because we have reached a hard target, therefore we can have the economy locked up. I mean, opened up, and then we enjoy all what it takes. Like, of course, the impact is so much. We are talking about the kids going back to school and getting the education, which is very good as far as human capital development is concerned of a country and human resource development. But even there, they are not being there. You don't know what it has on the economic side, big time. You don't know what it has. But we also need to look at the positive aspects of what COVID has also brought. Let's also not dismiss COVID and the lockdowns as mere shatters of the fabric that we have lived. There are also other positive aspects that COVID, these lockdowns have brought. We have been very close to our families, which something was never there before. We've got to know each other better. Those who are prepared, we are also blaming government for not planning. But what about plans at individual levels in terms of such risks coming to us at that level? We are talking of government, but at individual level. If a lockdown found me in the village, was I prepared to be there with my family? Or did I have enough food around me to be able to sustain my family during such kind of things? So I think there are other issues, the aspects that COVID, I mean not necessarily COVID, I mean the lockdown that have introduced that we could learn from and make us prepare better, as we also put to government to play its part. Thank you for the opportunity.
Thank you very much.
And Willis. And finally, Monicah, Honourable.
Finally, for me, this situation has exposed what a certain professor said. Of course, that situations like this expose the tragedy of, that theory of the tragedy of the commons. Because now, in such a situation, the dichotomy between the haves and the have-nots has even widened further and been deepened by the crisis. And that's the reason why we are here, to try to talk for the have-nots in our society, who are the majority. Because if we continue as business as usual, then we risk having, a further deepened society. And yet we're already experiencing the effect of having those have-nots versus the haves. The mitaimbwas are increasing, the break-ins in our society. And above all, the impact on our children's future, those who cannot be able to go to school, who have not been able to enjoy this sector for the last 2 years. And therefore, the planners, the president and his team need to also have a balancing effect. I would like to call upon them to open the country, because then we need to just live with COVID like any other disease that has been around. Continue with the vaccination, enforcement of SOPs, and above all, really, to allow Ugandans to be responsible, as the Honourable Mr. Bashasha has said, but also to give them an opportunity to chart out their future. Because in the end, government is not going to educate your child for you, is not going to put bread on on your table, and we are seeing the impact on society. The socioeconomic impact is enormous. And so as we make these decisions, it has to be a balancing effect so that people take charge of their destiny. We just need to learn to live with COVID. It is going to be here with a long time, but also, of course, in terms of its enforcement, government has to take measures to ensure that we live with this situation, also giving us an opportunity to chart out our destiny, self-determination as Ugandans, notwithstanding the effects and the presence of this problem.
Thank you very much, Monicah, for those parting shots. Thank you very much, Andrew Willis. Thank you very much, Sarah, for being here. And of course, Andrew, for joining us in your second appearance. And also, thank you very much, our dear citizens out there, for being part of this conversation. We of course, we have to be, and of course, like the team here has agreed, including Monicah, I think, that we have to get vaccinated. It's the only way we have to move out of the pandemic. It's the only way we have to regain our lives and also move forward as a country. Let's all get vaccinated. As Civic Space TV, we are saying let's all out there get vaccinated. Maybe it's the only way we can see a better Uganda. Thank you very much for being part of the show, but also importantly, follow this conversation on our Civic Space TV YouTube channel. Subscribe. Also go to our Facebook. We have been live there. Please place your comments, follow the conversations, and importantly, on our hashtag #ChatShowUG, please be part of these conversations that are happening everywhere on the issues that are affecting us around the country that we bring to you almost every Friday. Please be with us, and we meet next Friday. Thank you.